This segment is sponsored by Texas Integrative Medicine and Cardiology.
Welcome back to Daytime with Kimberly and Esteban. I'm Amy Licerio here with Dr. Oscar Aguilar of Texas Integrative Medicine and Cardiology. Thank you so much for stopping by the studio.
Thank you, Amy, for having us.
Absolutely. Tell me a little bit about what you do at TIMC.
You know, at TIMC, what we do is look at the human being as a whole, the way we are. Traditional medicine in general tends to look at each organ separately and therefore give a medication for this or for that. However, we cannot forget about we are one human being. And we come from one single cell that is divided multiple times, and now we're 10 trillion cells. Nonetheless, all of those are really in close contact. There's a huge communication between the gut, the brain, the legs, the muscles, the heart, everywhere. Most of our patients come up and saying that they're tired. A lot of the females have joint pains, they cannot sleep well, they're under a lot of stress. Everybody's under a lot of stress. We in medicine don't have a perfect way of measuring it. Now, in our clinic, we do it through saliva cortisol. That's perhaps the best way currently to measure it. But the most important thing is, how do you treat it? You cannot treat it with a pill. You cannot treat it with 2 or 3. You cannot treat it with 10 pills. You need to go to the roots of the problems. And it's going to be acupuncture, maybe meditation, but of course, food intake, what you're eating makes who you are.
What is it that you would recommend for people that are curious and they just want to know a little more about what you guys do at TIMC?
Yes, we see new patients every day. We get referrals from other physicians. But I would like to invite people just to look in the general picture in the internet or wherever the source may be. But you have to be careful where the source is at, because right now on the internet you're going to find a lot of the marketing tools that perhaps are not scientific. You need to make sure that you go to academic, scientific data to know what we're dealing with.
So essentially, you help patients figure out why it is they're not feeling their best, and it's all by taking a closer look at the little parts of them.
That's completely correct. We even measure vitamin levels, thyroid panel, the whole panel, stress levels, as I mentioned, and general laboratory data that everybody does. But we measure very important things like inflammation markers, and we target those as therapy. And it's not expensive to measure those. In fact, whoever has insurance or Medicare is going to be covering for those measurements.
Thank you so much again, Dr. Oscar Aguilar, for joining us today.
Thank you, Amy. Thank you, guys.
Thank you. Now, this is Dr. Oscar Aguilar with Texas Integrative Medicine and Cardiology. If you want more information on what he can do for you, reach out to him. You can find them online at timcelp.com.